Hi everyone, this is Dr. Richard Shuey of Back to Health Chiropractic, and what I wanted to do with this video today is give you kind of an overview of how I treat patients, what a typical treatment looks like. That way you can make a better, more informed decision on whether I'm the right chiropractor for you. So where I'll begin is to first off tell you that I've been in practice for nearly 16 years now, and I'm a Palmer graduate. And then over those 16 years I have learned many different techniques. So there's many things that I can do in this office, but what I want to do is I want to kind of give you what a typical treatment kind of looks like these days in my, what I found really works nicely. Of course, there are times when I want to do some of the other things that I've learned in the past. They make more sense for you at that time. But this is the more typical one. First off, my adjusting. If I were to deal with somebody's joint problem, so let's say someone has some neck pain, and it's it's dysfunctioning, it's not working right, and I needed to adjust those joints. The way I like to do that is I like to use this instrument right here. This is called an impulse adjusting tool, and it is it's the latest and greatest in technology for handheld adjusting tools. Okay, so what makes it different from the other things that you might have heard? First off, there's the activator out there, and that's another instrument adjustment. That's a spring-loaded instrument. This is an electronic one, and what it does is I can make it not only a single thrust like you can with the other one, but I can also make a multiple thrust just by holding it down. And this thing is the frequency of that adjustment has been tested, and we know that frequency of the thrust actually helps the adjustment to improve joint motion and to improve the nerve control over that joint as well. So it's a very effective means of doing it. Now I do manual adjusting as well, but this is the main way, the thing that you get for joint problems in my office. Now that shouldn't be the only thing that you get though, because you see most of our problems, let's say it was a neck problem, it usually doesn't just happen in the joints, but it is also happening in the muscles and ligaments and everything that kind of come in and create how that spine functions and the posture and the likes. You've got to work with those things. Sometimes you get muscles and the likes that are restricted in their motion because of, say, trauma, or just over time they've become shortened because of the many things that we do. You might be spending time at a computer and having your head for 8 hours a day down like this, where it's held forward with your shoulders rolled forward, and that can create a great deal of stress and strains in through there. And so, you have to deal with that. Now, what I want to do is kind of give you a little bit of an overview of that. If I'm going to say that my hands are the muscles in my neck, okay, or some of the muscles in my neck, and they come in pairs, right? So there's one on each side. And let's say that one person has an injury in this one. So this one, maybe it was a car accident where they got ripped and torn, and that muscle restricted and healed improperly. Now, can you see that if I turn my head to this side, how easily the muscle would relax and allow my head to turn this way? But if I go to this side where it's been restricted, now I can't move it as well to that side. And that's going to transmit the forces back into the joints, and it's going to hurt them. It's going to increase the strain in that area. And if I go and I make an adjustment with the instrument, and if I don't correct this, it's going to quickly come back to being dysfunctional again because of that. So I've learned a technique called the myofascial release. It's the John Barnes approach to myofascial therapy. And it is I've been doing it for over 10 years. It's an exceptional soft tissue work that is very effective in taking care of the restrictions and scars that happen in the joints, in the ligaments, and all the fascia, the connective tissues of our body, and the muscles, okay? And allowing them to free those up. Now your head can move better, and the adjustments will hold better. Your joint movements, you need them both. You can't just do one without the other, because if you don't take care of the joint problem, the irritation there will just cause the muscles to contract up again, and then if they're held in that position, they'll become, the connective tissues will just shrink back down again, and you'll have the same problems too. So you got to kind of affect them from both ways. Those are the two things that you really should get if you're trying to improve function in an area, whether it's the low back, the neck, the hip, the shoulder, it doesn't matter. You need to work on the muscles, ligaments, and tendons, and the joints, and then the nervous system's control of that. And that's what the adjustment does and the myofascial work. There is a third component that we also do in this office that's very important. It's a three-prong attack that I use. You use adjusting for the joint structures and the nervous system. You use myofascial therapy for the muscles to get them functioning and working smoothly, and all the other fascia. And finally, exercise to retrain the brain's control of those muscles and to take care of weakness that could be creating the problem. For instance, in neck pain, people with chronic neck pain have weak flexors and extensors, okay, compared to an individual who doesn't have neck pain. So we want to give the right exercises to strengthen those two aspects of things and take out anything that's not quite working right. And again, retrain the brain to use these muscles better as well. That's another very important component of it. And the research shows that if you take chiropractic care and you take the exercise and put them together, you get far better outcomes than you do if you don't, if you just do chiropractic or exercise by itself. Okay, so that's a typical kind of look at what I'm doing in the office at this time. Okay?